Hello, everyone, and thank you for coming and joining us today at our Regional Community Coalition. My name is Jennifer Stewart, and I'm going to be getting everybody moving along today. Just a quick reminder, if you guys can please make sure you mute your microphones while we're moving along. If you have any questions, please enter them in the chat box. We will try and get to them if we can. If not, we'll make sure we send something out in an email so that we can answer them, or we'll make sure we do so on the next coalition. If you have other things that you would like us to do, or please share your experiences with the group, and we'll make sure that we highlight those. If you could also put your name, organization, the coalition, and location that you are with, and any activities or updates you'd like to share with us in the chat so we can make sure we know who is here today, that would be appreciated. I guess I am clicking on the wrong one, so sorry. Let me catch up with these. Today we are going to have Ray with our analytics going over some combined regional data updates for us. And then afterwards we will have Kyla going over our vaccination updates. And then followed with a presentation on Vivin Health. It is our new immunization platform that we are rolling out. So Natasha Dickinson will be going over that for us. Really quickly, I just wanted to mention, if our regular meetings are a great way that you guys can support Mountain Pacific in letting us know how we can support you. Our coalition members are, you guys can make sure that you guys always keep us updated on any member names or contact information that might need to be changed. That way, when we're sending out stuff, we're making sure it gets to the any additional partners, and we're getting it to the right people. If we can, our metrics and our data are how we identify what's the most important areas for you guys in the community. So if you aren't wanting to work on one area, but you need help in the other, that's how we work on that. And then if you have not signed our participation agreement, please let us know, and we'll make sure that we get you one of those so that you can sign that and get it back to us. That's how we make sure we can go over data and other things with you, and that we have that information and things signed and in the right places. Our 5 goals for community coalitions that we focus on are reducing opioid adverse drug events, so AEDs and deaths, chronic disease management, care coordination across care settings, emergency preparedness plans, and immunizations. So we try to focus on those around our regions and our community coalitions. And with that, I am going to let Ray, with our analytics team, go ahead and take over so he can do his presentation for you guys. If you have any questions about the partnership agreement, please let us know. Otherwise, Ray, I think that's for you now.
Okay. Yeah, I'll share my screen. Yeah, and thanks, Jennifer, for the intro. My name's Ray. I'm a member of the analytics team here at Mountain Pacific. Today, we're going to be going over some 30-day readmission data. We're going to look at it at our regional level, and then also dive into some of our states as well. So let me see if I can share my screen. Jennifer, you might have to stop sharing. There it is. All right. So you should be able to see my screen now. And so what we're looking at here is our regional readmission rate per 1,000 beneficiary years. So this is counting our 30-day readmissions. Over on the y-axis, we have our readmission rate. On the x-axis, we have time. So the time frame we're looking at here is Q1 of 2020, all the way through to Q4 of 2023. So we see that big COVID drop in our readmission rate, and since then we've been pretty consistent, keeping our readmission rate, at or below 2.5 readmissions per 1,000 beneficiary years. And I should also mention, again, this is regional data. It's combined data across Alaska, Hawaii, and Pacific Territories, Montana, and Wyoming. So throughout that region, let's take a quick peek at the diagnoses that are driving these readmissions. So if we scroll down here, we're going to be looking at regional readmissions by diagnosis. So on the y-axis, we've just got count of readmissions. And on the on the x-axis, we have time. Again, same time period, Q1 of 2020 through to Q4 of 2023. And what we see here is this yellow line at the very top. That is the presence of CKD on a Medicare beneficiary's claim. Throughout the entirety of this time period, CKD has been the most frequently occurring ICD diagnosis code, followed by diabetes and hypertension. And finally, that teal line is heart failure. So really what I take away from this chart is that there's a very close link between chronic care management and care coordination. And so as you see this yellow line here, we have had an uptick in chronic kidney disease. And so it's just something to be aware of out there throughout our region. Now, again, that was very high level data. Let's take a quick peek at our states and see what readmission rates look like there. So starting out in Alaska, this is our readmission rate per 1,000 beneficiaries through time. Again, same time period. Alaska pre-COVID was sitting just above 3.3 readmissions per 1,000 beneficiary years. They're currently at about 3.1 readmissions per 1,000 beneficiaries. So overall, you could say there's a downward trend. But that being said, readmission rates have been a little bit more volatile in Alaska. Moving on to Hawaii, we'll see how that compares. So Hawaii is now that blue line. Hawaii has been consistently lower in readmission rates over time. And again, we see an overall downward trend. So Hawaii pre-COVID was about 3 readmissions per 1,000 beneficiary years. They're currently sitting at about 2.3 or 2.4 readmissions per 1,000 beneficiary years. Moving on to our Intermountain West states, we'll add Montana on there. Let me move Alaska off so we can get a comparison here. So Montana is this blue line here, and we still have Hawaii as the red. Montana has actually overtaken, or should I say undertaken, Hawaii on their readmission rates. So as you can see, pre-COVID, Montana had a relatively high readmission rate, just above 3.5. They are now down below 2.3 readmissions per 1,000 beneficiaries. So my hat's off to Montana and our partners there for helping us get that readmission rate quite a bit lower. And finally, we'll take a look at Wyoming. And so Wyoming is now that blue line there. Wyoming, Montana started pre-COVID very close to one another. That gap has since widened in readmissions. And in fact, Wyoming's been pretty consistently above Montana for readmission rates throughout this entire time period. So the only other thing I'm going to take a look at here is we'll look at some of the diagnoses that are driving these at the state level. And I'm just going to do a quick comparison between Hawaii and Montana. So again, we're looking at counts of readmissions by diagnosis code. So in Hawaii, chronic kidney disease is far and away our most frequently occurring diagnosis code grouping, followed by diabetes, that green line. And then third and fourth place, we've got heart failure and hypertension jockeying for third and fourth place there. By contrast, what we see in Montana is a much closer race here. So if you noticed, that blue line for hypertension has moved up. And that's something we see in our Intermountain states from both Montana and Wyoming. Hypertension is much more frequently occurring. But that being said, the big takeaway from this is that link between chronic care management and care coordination. So with that, I'll sign off by saying, if you do have a participation agreement in place with us, we can share this data with you. Feel free to put your email in chat. And if you're interested in some state level data, please let me know which state. And you can always reach out to one of our fantastic account managers, and they'll connect us and we can share some of this data with you. So with that, Jennifer, I'll hand it back to you.
Thank you, Ray. I am going to put my screen back up and see if we can move on. I appreciate that. And like Ray said, if any of your if any of you need additional data, please reach out. Ray can help break down some of that per state if you're looking, and sometimes go a little bit farther on that so that we can help go ahead and help each of you a little bit further if he needs to, so he can get some additional data if any of you are looking for that. Moving forward, we're going to look at some vaccine updates. Kyla, our PharmD, is going to go over vaccinations with everyone and some of the updates that we've been seeing on that. So Kyla, if you want to share your screen, I'll stop sharing again and you can do that. Oh, wait,
actually,
no,
my
these
slides
ours.
are.
Yep. Yep, I just remembered that. So I will let me know when you're ready and I'll move forward.
Okay, thank you so much.
Yep.
And I'm really happy today because I'm located in Wasilla, Alaska, and it's 50 degrees. So spring is on its way, and I'm excited about that. So just a few updates to share with everyone today. As I think everyone is probably aware, in the fall, it was recommended that everybody get the updated monovalent version of the COVID-19 vaccine. And then they came out with another recommendation. I don't know how long ago it's been. It's probably been about a month or maybe a little bit longer than that. They came out with a recommendation specifically for people 65 and older, saying that they need to get one additional dose of COVID-19 for the spring season. And the only kind of caveat with that is that it has to be at least 4 months after the previous updated dose. So if we're looking at the technical definition of being up to date for people 65 and older, they basically need to have had 2 of the monovalent, current monovalent COVID-19 vaccine, 1 in the fall and 1 in the spring, separated by at least 4 months. We can go to the next slide. So the other thing that I wanted to highlight is something that folks may have seen in the news as well, is we're really seeing a lot of outbreaks in measles. So just giving a little history on when the vaccine was licensed, you'll see on the chart here, and how we had eliminated the disease in 2000. This chart does not go forward past 2020, but as you'll see, I believe on the next slide, we are now seeing this trend going back up. So we have seen actually 18 locations that have been having outbreaks, and this is as of April 18th of 2024, with a total of 125 cases of measles. So, and we know this is because folks are not vaccinating with the MMR vaccine as frequently as they were in the past. We can go to the next slide. So this states kind of some of the information I already stated. And if you can see, the majority of the cases, or 69%, are associated with an outbreak. Most of these, not most, but a substantial portion of the outbreaks are in Chicago, Illinois. And they actually have a specific dashboard where you can go on and look at how many cases, and then you can look at each location of where someone was identified, like say they were at Walmart, and it'll tell you where there's been cases identified, which I thought was kind of interesting when I took a look at their dashboard, and I can share that with folks too if they're interested. And just another kind of high point to highlight is, for comparison, in the year of 2023, there were 4 outbreaks. And here we are in 2024, and we've already had 18. So, and we're only, what, four months into the year. So I do think this is cause for concern and something that we should be aware of in our communities. And we can go to the next slide. This just shows the cases and hospitalizations. So as you can see in this under 5 age group, we're having the highest percentage in both cases and hospitalizations. And that's probably for a couple reasons. One reason would be because children typically get more sick with measles. And the other reason would be that the series for measles for pediatric patients, they get 1 dose at 15 months, and then they can't get their next dose until they're between 5 and 6 years. So those folks younger than 5 are going to be underprotected until they get that second dose. So as you're seeing here, 65% of children under 5 actually had to be hospitalized because of measles. And we can go to the next slide. That might be my last slide. Okay, so shoot me any questions if you have. And I will turn it over to Natasha to talk about an immunization training platform that Mountain Pacific is partnering with Vivint Health to share this information out to our partners in kind of micro learning bits. So Natasha, I will turn it over to you to do a little demonstration for us.
Great. Sorry. Thank you so much. Thank you all for the opportunity to talk to you. So my name is Natasha Dickinson. I am the Director of Clinical Affairs with Vivint Health. Vivint Health is an education company that specializes in interactive education. Is it okay if I share my screen? Okay, perfect.
Yeah, I unshared so you could do it.
Okay. So we specialize in interactive education. After listening to the information that was just presented, this is perfect just because it kind of is a way to reiterate the importance of vaccinations. I know that, you know, a lot of our community members are kind of tired of hearing about vaccinations and the importance of it. So what we are able to do is provide them the information in a new and innovative way. So nothing that we provide with our education is new, but it is presented in a different way. And with that, people are more engaged with it and more receptive. So I'll share with you a quick PowerPoint, just so I can tell you a little bit about us. Can you all see my PowerPoint?
Yes.
Okay, perfect. Okay. All right. So just a little bit about Vivint Health. So we are founded by Dr. Tom Ahrens. He is a sepsis expert. So he created this company in the hopes of preventing infections in the community. So we provide education in an interactive form that is very easy to assess. So instead of needing a specific program or specific computer to get to our program, all you need is your cell phone and a QR code. That's it. So the user just simply scans a QR code and they are able to go directly into our program to get the education. Now, since we are all about interactivity, we provide our education, and I like to say tidbits of information, comprehensive education. We don't use a lot of words. We're all about doing and that interactivity part. With this interaction, it is proven to be more effective than the traditional passive learning. My background is in nursing, so I've been through countless amounts of education requirements and in-services. And let's just be honest, they're boring. A lot of times you'll just click, 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 or you press play, you walk away, you press play, you walk away. Not very effective. So we wanted to kind of change that trajectory of education and make learning fun again, make it engaging. So with the vaccination program that we have created, it doesn't just provide education where a reader or a learner is just reading. They have to engage to be able to acquire the information. And with this, it leads to behavior change. So this program is completely free to your organization, doesn't cost you anything at all. It is underwritten by Mountain Pacific. We are trying to educate families, patients, individuals, everyone on the importance of vaccinations. Not just COVID, but all of the recommended vaccines, such as RSV, influenza, COVID, pneumonia. We do provide our education in a variety of different languages, and the user has the option to change language within the program themselves by a simple touch of the button. Now, not every language is available. However, we do our best to incorporate every language. If there's something that's not there that you would need, you just let us know. So the vaccine program, it does provide up-to-date information. We have the current recommendations that were just presented, the new April update. So those are in the program already. And we do update our program about every 2 to 3 weeks to try to stay up to date because there's always changes. Like I said earlier, we must be innovative in our delivery with vaccination education right now. And that's just because, we've heard it time and time again about vaccinate, vaccinate, vaccinate. So we have to educate people in a different way. You can't just give them a flyer and expect them just to read that. You can't just tell them. Now we want them to engage with something. And this program is the perfect turnkey resource to provide that education. So any questions so far? Nope. Okay. So I am going to share with you just a quick little video on how to get started as a community partner. As a community partner, you are so valuable in our mission because we need information coming from trusted sources. You all have the relationships with community members that really can make this program be effective and for us to really create a change. So this video here is just really short, but it just kind of walks you through on how you can be a help. Okay, just making sure, do you all see a video on my screen?
Yes.
Yes.
Okay, sorry. Okay. Play this.
Welcome to the Mountain Pacific Vaccine Initiative. We thank you for taking a stand in this vital community effort. With the help of you and our other trusted partners, we can safeguard our most vulnerable community members, increase vaccination rates with RSV, COVID, pneumonia, and influenza, and set a blueprint for other communities to model. Let's take a look at how you can help make the largest impact. The success of this initiative is dependent on community partners like yourself distributing the vaccine program. Examples of distribution can be through social media, printed flyers, and community outreach events. Don't worry, we will provide the tools needed along the way. By promoting the program on your social media platforms, it allows for significant outreach. We can create the social media posts or consult with your marketing team. The goal is to make this easy for you. Flyers have already been created promoting the program. We can email a copy for you to print and distribute. All printed material can be customized with your logo. Or you can simply bring a new element to your community events by educating on the importance of vaccination. It is that simple. Protect our community by distributing the vaccination program. To learn more about getting started, or if you have any questions, please contact us today.
Okay, so that's just a kind of just a brief overview on how easy it is for you all, to have the opportunity to help get this word out with vaccinations. I know right now sepsis is a huge issue and it's getting more and more attention. But a simple way to prevent sepsis, not only with hand hygiene, is just vaccinations. So now I'll just briefly show you again how quickly and easy it is to help with distribution. So we've already did all the work for you. We've created flyers, which we can email them to you. They look just like this. All we need help with is just that distribution part. So, you can do the distribution in a variety of ways. There's no certain way. They can be used as leave behinds. You set them on your counters, on bulletin boards. They can be emailed to individuals. You can distribute it at community events. You can incorporate your staff through in-services. There's no right or wrong way to do this. The whole key point is just getting that QR code in the user's hand to educate them. So step 3, the user then just registers and they are able to complete the program. It's that simple. So if you all have your telephones with you, I did go ahead and put in the QR code just so you can kind of get a feel for what the process looks like to get started. So all you do is you scan that QR code, and then it's going to come up to a registration page here. So all you do is you select your region, your facility type, whether it be an assisted living, a pharmacy. You type in, this says reg auth facility name. That's a typo, it won't say that, but you just type in your organization name in that spot, your phone number, your name, and your email address. With that, we are able to provide data on how well your organization is doing with distribution to see how many people are actually using the program through your organization. And I always like to make it a point to say that we do not use your information or any of the users' information for anything other than this program. And it's just basically in case there be a technical issue. Okay. Step 3, the participant, once they complete the program, they then just print it off, and it is either able to be emailed or printed. Okay. So what's next? You just print off the flyers, you distribute it, and you get started. And then before I get off here, real quick, I just kind of want to show you and walk you through how easy it is to actually do the program and what the interactivity looks like. Okay, just give me. All right. Can you also see my screen?
Yes.
Yep.
Okay. Okay. All right. So this right here is just kind of an overview of the education that we provide. Like I said before, this is nothing that's brand new. It's information that, we've all received, but we are presenting it in a different way. So we are all about the interactive part. So instead of telling somebody that, how an infection or how bacteria enters into the body or what the effects are of different comorbidities, we show them. So this example here, we tell them what happens when you're vaccinated and when you're unvaccinated. These are just 2 quick little videos here.
When you were unvaccinated, your body does not have extra defense to protect you from the virus. Because of this, the virus invades your body, triggering an immune response. This can lead to hospitalization and, even worse, death. Don't let this be you. Get vaccinated today.
We try to give the user kind of an emotional response by having certain videos play. Okay, one more video here.
When you are vaccinated, you give your body the antibodies it needs to fight off the virus. As your body is primed to fight the virus, you are likely to experience less severe symptoms and be less susceptible to significant side effects when you contract the virus. You will also have much less of the virus in your body, reducing the chances you will spread the virus.
Okay, so now we'll take a step further and we'll show you how this interactivity works. Okay, so in this next interaction, we are teaching individuals what happens whenever you have different comorbidities, such as being over 65 or having heart disease or lung disease. So everything you see is not a video. This is actually me moving the mouse. So I'm dragging the different items to tell you what happens with the comorbidities. So if you are over 65, or if you have lung disease, what happens? The germs that were sleeping, they suddenly become awake, meaning that you're more susceptible to getting pneumonia. With heart disease, what happens? You're more susceptible. If you do something protective, I'm going to show you right here what happens. Once again, we try to get that emotional response. If you do something protective, like getting a pneumonia vaccine, what's going to happen? It's going to get them germs away. Other things like hand washing helps contain everything and keep you protected, or cleaning surfaces. Now, what you're seeing is not a video. It is me actually moving my mouse to do this. Another concept that we do use is something called discovery learning. With discovery learning, we do it based on this premise that you can teach somebody something that they have no idea about by kind of like trial and error. So I'll show this last part and then I will conclude my presentation. So as far as who should get the vaccines, this is based on that premise of discovery learning. So a user has to pick and choose where each category should go. If you do something in the wrong category, it's going to stop you. And you have to try to find that correct category. Now, this is kind of based on, I like to call it trial and error. And by choosing the right answer or choosing the wrong answer and forcing you to find the right answer, that's how that behavior change comes about. Okay, so I'm going to stop sharing here and leave it up to any questions anyone may have at this time.
Thanks, Natasha. Did anyone have any questions about this for Natasha? We'll make sure that your contact information is given out so that if
Okay.
anyone has questions, or they can reach out to their account managers so that if they are interested in getting signed up, and that way they can go through them and follow up with that as well. And so Mountain Pacific will be able to help people sign up with their organizations and things as well, if they're interested in doing that.
All right. Thank you so much. I appreciate it.
Yes, thank you for coming and presenting for us. And then at this time, it looks like we have a polling question for everyone. So you should be getting a question that'll pop up. There we go on your screen. If everybody could take a minute and answer this question for us so we can get some feedback, we'd appreciate it.
Jen, if I can hop in here while folks are filling that
please do.
out. So just kind of tying together the data that Ray showed us about the admissions, and then what Natasha talked about sepsis, and then bringing into the picture the fact that CMS is indicating to us that it's going to be an area of focus in our work moving forward. So that's why we wanted to do this polling question today to see what folks already have in place and how we may be able to add value to reduce sepsis in your communities. So thank you so much for participating and giving us this information.
It's like people have slowed down, so we probably could end when. I think we're probably good, Mary. We haven't had any responses in a little bit. So, okay. with that, upcoming events for what we have going with Mountain Pacific, our next Worth of Shot series will be tomorrow. We have it every Wednesday. If you're interested, we have a registration that you can sign up for. We also have our Breaking Barriers podcast series. We have where you can see all of our episodes that we have so far. It is an ongoing series, so there will be new updates on the podcast periodically as they get uploaded and done. We will have our next regional community coalition I'll call on July 23rd, so you can register for that as well. And then some resources and references so that you guys can have those as well. There's the CDC. Our zone tools are on our Mountain Pacific website, as well as our chronic disease tools and resources. We have a resident information booklet for if you would like to go or stay at the hospital. It gives some information on what to look at. That since we were talking about readmissions, that kind of goes over some good questions on if you should stay where you are, nursing home related or at home, or if it's time to kind of go to the hospital and assess those questions, along with our class checklist on culturally linguistic and appropriate services. And then with that, are there questions that anyone may have for Kyla, Ray, Natasha, myself, any of that? We'll be happy to answer those. If you do have them later, you can certainly reach out to any of your account managers. They are happy to answer those. And then if there are questions that we didn't get to in chat, we will make sure that somebody reaches out to you as well. Kyla, do you have anything else? Ray, anybody else from Mountain Pacific? You're happy to jump on if you have anything that might have been missed.
I don't think we missed anything, but I did want to mention something that came out last week in Alaska is the fact that the state has decided how they are going to distribute the opioid remediation funds. As many of you know, I also work on opioid safety and harm reduction efforts, and I know that many of you do as well. So for Alaska, they're putting out $3.3 million every, I think it's every 3 years, that to 7 different communities in Alaska. And they put out the RFP for that last week, so I can share the link in chat if folks are in a community where they might be eligible to apply for some of those funds. And that is happening in all of our states. It looks a little different in all of our states. So if you have questions about that in your state, we can definitely try and get you connected with the correct folks because it is being distributed nationwide. And it's a lot of money.
Yeah, thanks, Kyla. That's good.
We really do thank you for your time today, spending time with us and sharing with us your needs as we move along in partnership.
Yeah, and I'll just echo what Kyla said. Thank you. You saw in my presentation today, I was able to say we've got downward trends in all of our 30-day readmissions across all of our states. So it sure makes my job a lot easier to share great news like that. So thank you for your help.
We do appreciate everybody's help and all the collaborations that we've had. It has been wonderful to work with everybody, so we do appreciate you all. And on that note, we will let everybody have some time back in their day, and I'll see everybody on the next coalition meeting. Thank you all for joining us today.